presenter for today. Thank you, Dr. Vasquez, for being here, and welcome everyone.
Hi, thank you for the presentation and thank you for inviting me to this webinar. I'm very proud to, well, first of all, happy Pride to everyone. This is the month of Pride, so it's a great opportunity to talk about this topic, which I think it's going to be helpful for a lot of us that are working with the Latinx LGBT plus populations. So welcome, thank you for being here, and let's get the show started. Well, the HTTC network uses affirming, respectful, and recovery-oriented languages in all activities that language is, and this is the ways you can see and you can express that language. This is a disclaimer which says this presentation was prepared for the National Hispanic and Latino HTTC under a cooperative agreement from the Substance Abuse and Mental Health Services Administration. All material appearing in this presentation, except that taken directly from copyrighted sources, is in the public domain and may be reproduced or copied without permission from SAMHSA or the authors. Citation of the source is appreciated. Do not reproduce or distribute this presentation for a fee without specific reading authorization from the National Hispanic and Latino MHTTC. This presentation will be recorded and posted on our website. At the time of this presentation, Tom Codier served as Acting Assistant Secretary for Mental Health and Substance Abuse at SAMHSA. The opinions expressed herein are the views of the speakers and do not reflect the official position of the Department of Health and Human Services, or SAMHSA. No official support or endorsement of the DHHS, SAMHSA, for the opinions described in this presentation is intended or should be inferred. There's nothing to declare in terms of conflict, so let's get right to it. These are the four main objectives that we're going to cover in this webinar. The first of all, I like to start from the beginning. It's to define basic concepts related to the LGBT plus communities. It might be a review for some of you, and that's great, but it's always good to review. Number two, describe the minority stress model and contextualize LGBT plus Latinx's life experiences. I think this is very important to overall contextualize this to the Latinx community specifically. Objective three, identify Latinx cultural values and their impact on LGBT plus Latinx communities. It is very interesting and important to observe the intersectionalities that coexist between the Latinx community and the LGBT community and how they impact their livelihoods. And objective four, address cultural adaptations of the affirmative model for Latinx LGBT plus. So thank you for being again. I say that because I'm very happy to be here and because I think there's a lot of work to be done with this community. So these are the basic concepts. I want to address three main concepts that are basically the most inclusive way of talking about the LGBT plus community. It's talking about sex, gender, and sexual orientation. When we talk about sex, we're talking about a biological concept that is based on three main things: genitalia, internal and external, hormones, sex hormones, and sex chromosomes, which are XX, XY, and other alternatives as well. The sex is assigned at birth, and usually the doctor is the one that assigns it. We can see it before in the sonogram, but it's confirmed at the birth of the kid. So it's very important to see that sex is only biological, and that doesn't mean that we're going to know the roles, the gender roles. We're not going to know the behavior or the way that person identify. That is more a gender concept, which is the next I'm going to talk about. Gender is a most social concept. It's a construct. And once you see the sex, society constructs the gender on top of sex. If we are sex assigned male at birth, we're going to be looking and expecting masculine behaviors, masculine roles, and other type of identifications for that specific sex. So gender is very important because it not always correlates to the sex assigned at birth, and this is one of the things we're going to talk about today. Gender divides into mostly gender expression, which is what we show to the world, and gender identity, which is how we construct ourselves and how we see ourselves in our minds. And the last concept is sexual orientation, which I always say has nothing to do with sex and gender, which are the concepts that we talked about right now, but it's an arrow that comes from one body to another body. Depending on the gender identity of those bodies is how we're going to define sexual orientation. That arrow is the arrow of desire and attraction, and it's going to be defined every single way we can be attracted or desiring someone. It can be emotional, it can be erotic, it can be social, it can be intellectual, spiritually, and all the ways we can be attracted to someone. So that is sexual orientation. And our community is diversity in these three concepts: sex, gender, and sexual orientation. That's the most inclusive way to talk about our community. So when we see the acronym, it's very problematic to keep on adding letters or subtracting letters. It gets very confusing because a lot of our categories are social constructs. We will keep on adding different letters as we go along because the diversity is very immense. But for the public, it's kind of problematic. No one knows which is the correct acronym that we should use. So a lot of people are talking about how to be the most inclusive way. I believe in branding too. People already recognize the four main letters, which is LGBT, but we always should add the plus sign, which means we are including also more diversity than just the main four letters. But if we want to be even more correct and even more inclusive, we should talk about the community that's diverse on sex, gender, and sexual orientation, which is really what we're talking about. We can see here in the gender unicorn, it's a tool, a very good tool, and for clinicians. It's not necessarily meant for clinic settings, but I use it all the time. It's a great way of showing our patients or clients where are the different concepts. And you can see that each concept is a spectrum, which is important too, or a continuum, because we know that you can be completely masculine or you can be half masculine or somewhat masculine. So it's a spectrum, and we should talk about gender this way, and attraction as well. The main point of the gender unicorn is for people to self-identify. And as a therapist, it's a great and very insightful tool to use. So this is the main acronym. There's an additional Q that sometimes we add. We want to see the letters being explained, so we're going to define them. But as I said before, the most important concepts are the three that we discussed earlier: sex, gender, and sexual orientation. But when we talk about lesbians, are women who has physically, romantically, or emotionally attractions to other women. Gays are men who are attracted to other men. Bisexuals are persons independently of their gender that are attracted to other persons independently of their gender. And those are the three main concepts of what the diverse populations of sexual orientation. When we talk about transgender, we are adding the concept of sex and gender. Transgender is a community that is going to be diverse on sex and gender, as I said before. Some people are going to be only in gender, and other people are going to be uncomfortable or not identifying with the sex assigned at birth, and some will try to change that for their lives. And that's the transgender community. And when we're talking about questioning, is a category that is usually reserved for adolescents, but it's not the only way we use it. We know that people all through the development could be questioning their sex, their gender, or their sexual orientation. So it's a category that is very inclusive and does not require a person to self-identify upfront. And other two categories that are very important, and this is the extended version of the acronym, it's intersex, which is usually, it used to be hermaphrodite, the term that was used. But now to be more inclusive and more correct, we use intersex. Intersex are people that are diverse in sex, specifically that are born with ambiguous genitalia, which is not either male nor female or a combination of both, has sex chromosomes that are different from XXXY, or have secretion of hormones, which is different what expected based on the sex assigned at birth. So that is the intersex community. We usually talk about the intersex community because there are people that actually feel comfortable being intersex. And there's a lot of reproductive and a lot of birth rights that are very important for the intersex community. Asexual is another part of the sexuality, which means that are people that do not have sexual desires or sexual attractions. That doesn't mean they won't have romantic attractions. So this is a persons that are comfortable identifying as asexual. So why is this important? Basically because we live in a heterosexist and cisexist world. Heterosexist means that most people know and feel that heterosexuality is the only way or the only appropriate sexual orientation. It is a privileged category, and most people feel that that is the most healthy way of living, which is, when we look at research, not the only way, as we should know. Cisexist is in the world of gender the same thing, but it prioritizes on cisgender people, which are people that are not trans or are not from trans experience. So cisexist is always thinking that people that we have in front of us are cisgender, and not even regarding the fact that there could be diversity in gender as well. So this both things makes people assume our sexual orientation and our gender identity all the time. And that is one of the main problems that once we see correlate with violence, with discrimination and prejudice. So this is one of the things we should talk about and see the experience of the people that we're working with. This is a graphic that I wanted to pull out to see so that we kind of understand or get a feeling of how these things develop in ourselves. We see that gender identity starts to develop between the ages of 1.5 or 1.5 years and 3 years. And then at 4.5 is when parents begin to notice the differences between gender behaviors. And at 6, the minor actually recognizes that different behavior. That is very important to see, because when we talk about gender and we talk about trans community, we can see that the development starts much, much earlier than when they actually talk about their gender or actually express their gender identity. When we're talking about sexual orientation, this is different. Research have shown that it could be between the childhood through adolescence that it becomes to develop. And we see in a specific research that says that the mean age is 8 years old, but then we see that they come out, and we're going to talk about that concept later on. They come out in the late adolescence, which is important for us clinicians to know that even when they are talking to us about their sexual orientation, that means that they identified that before, probably before they talk to us. And that happens to families too. They start thinking that this started today when they actually know the information, but it actually started probably a lot before. So coming out is a term that is very important in the LGBT plus community. It is an event or a series of events, I should say, because it's not just one event. People come out to different publics or different scenarios, so that is important to recognize. It is a very difficult process because people are sharing their sexual orientation or their gender identity and exposing themselves to either acceptance or rejection, or something in between, ambivalence. So it's a very important concept and something to ask in our history when we're searching for all the information that we need to assess the person and what's going on. So LGBT youth should have the right to self-determinate. They should choose how, when, where, and to whom they will come out. And that is something very important. Us as clinicians, we do not have the right to take them out of the closet. So we're gonna start talking about the minority stress model and the Latinx communities. It's a very important model to address because in literature it has been very successful to determine and to see what is the exposure to stress and the possibility of psychological symptoms later on. So it's a elephant in the mouse kind of situation. Imagine being a mouse in an elephant's world, or in between a community of elephants. You feel powerless, you feel smaller, you feel that you cannot decide anything, that you could be stomped on every single time or at every moment. So it's very important to understand the dynamics that come from being a minority. And obviously minority is not necessarily in size, but in power. So it's important to begin to understand the feeling, how it will feel to be part of a minority. So I was reading a blog later a couple of years back that said it's a stranger in a stranger's island. And that means that usually, and it compared it with ethnicity and race, and how people that are from diverse races or ethnicities usually rest when they get home. They get bullied at school, they get bullied in work, those of them that are adults. But then when they go back to their home, they can rest from that, because usually people that are from diversity races, their families are diverse as well. So they rest there. But for LGBT communities, it's not the same. Usually LGBT folks come from families that are heterosexuals and cisgender. So there's a disconnect there, and they do not get to rest anywhere where they go. So that is something to keep in mind when we are dealing with the LGBT plus community. So let's first define what social stress is, which is social environment conditions along with personal experiences may be sources of stress that lead to physical and mental distress. Sexual minorities are those whose gender identity or sexual orientation are not heterosexual or cisgender, which is what we've been talking about. So these are the different ways that we can see gender and sexual minorities and minorities in general, depending on the categories. I did this, or I developed this based in Puerto Rico, which is where I'm from. I mean, you can see the majority or the privileged categories in gray, and the others are the minorities in colors. So this is something, and a good, I think a good way to understand intersectionalities. It's not the same to be gay, white, with education and from the city, than being gay, black, probably from Dominican descent, which is a minority here in Puerto Rico. I said black already, without education, and from the suburbs. So it is a rural area, I meant. So it's very important to understand that when we get more than one categories of minorities in ourselves in one body, that means that we are going to be more prone to experience minority stress. That could definitely develop into psychological symptoms that are difficult to handle. Okay, so this is the most important thing about minority stress, and it's very evidence-based. So it's important to understand that the William Institute did a research which contemplated the LGBT community, and they found out the most prominent diversity community that lives between the LGBT plus community is 21% of Latinx. So this is what we're talking about. This is why we're here, and I think it's a great and important community within a community that we need to address. So these are a couple of researchers that I've seen in the literature that talks about the interactions between being LGBT plus and Latinx. They found that 25% had major depressive disorders diagnosis, and 37% alcohol use disorders. And when we compare that to Latinx heterosexuals, they found that 11% had major depressive disorder and 13% alcohol use disorders. So we can definitely see the drastic changes that is almost 2 times or 3 times the statistic that we see in heterosexual folks. So when we add the LGBT plus community to the Latinx community, it definitely we can expect to be more prone to experience stress. This may produce adverse psychological reactions such as hypervigilance, concealing one's identity, and the internalization of homophobia, which may increase risk of mental health disorders. So this brings out dynamics that are very crucial to their mental health. So being hypervigilant is not is something trauma related, and we should even talk about how living as a Latinx LGBT plus community is a traumatic experience in some cases and most cases. And the internalization of homophobia and LGBT phobias is mostly understanding and interjecting what people, the myths and what people say, the stigma around being LGBT. So that is very difficult to handle when we believe those sort of myths and beliefs. Research also has shown that LGBT plus Latinx have higher rates of depression and suicidal ideation, lower levels of self-esteem as a result from parent rejection. Latinx men have higher levels of child homophobia, and 91% indicated they had heard that gays are not normal. 70% believe they embarrass their families, and 64% reported that they felt it necessary to pretend to be heterosexual. According to the National Survey on Discrimination, 47% of trans Latinx and gender nonconforming are accepted by their families. So the other part is not accepted by the family, 53%. So it's a lot of percentage of people that are rejected from their families. So this is a couple of research and statistics to show that definitely intersectionality is a risk for health. So these are a couple of events in history that has definitely affected the LGBT Latinx communities. Specifically, and we are in a Pride month, so we had to talk about Stonewall. Stonewall is a series of riots that happened in the Stonewall Inn, which is a bar and hotel in New York City. Into the June 28th and 29th, the NYC PD usually did a lot of raids around bars that were meant for the LGBT plus community. It resulted in unnecessary, well, you know what police do, arrests and all of that. And this time, the LGBT plus community were fed up with this, so they decided to fight back. And this, I'm talking about this specifically in the Latinx community because sometimes when we talk about history, we exclude that Latinx people and people of color were the ones that were leading the riots. And this is Martha P. Johnson and Sylvia Rivera, which are transgender Latinx in case of Sylvia Rivera, and people of color in case of Marsha P. Johnson, that actually were the first to actually start the riots. And their leadership was very important for the LGBT plus movement, rights movement. So it's important to recognize the presence of Sylvia Rivera, which is of Puerto Rican descent too. And in 2016, the Pulse massacre happened. 49 people were killed, 53 were injured, and it dramatically impacted the Latinx community because it was Latin night on that club. So a lot of people from our Latinx LGBT plus community died. And that is something to remember. The recent days, I think 2 days ago, President Biden actually commemorated Pulse with it being a national memorial. So we have to talk about Latinx values. Our culture is different from other cultures, and it definitely has an impact on what our livelihood, the LGBT plus livelihood, is going to be. So it's important to see and to actually understand how different values will impact positively or negatively to our development. So the ones that we're going to talk about is familismo, spirituality and religion, fatalism, Marianismo y machismo, and we're going to talk about how that impacts coping mechanisms for stress. So in the case of familismo, is an attachment, commitment, and loyalty towards family members, including extended family. So sometimes familismo makes it very important to be respectful and to be truthful and loyal to the community, to your family. Some Latinx queer college students conceal their gender identities to family members as a way of showing respect and sense of obligation, and that alters the regular development that would happen around coming out. So they can delay their coming out for this. That not necessarily is something positive. I believe that can be something very negative. Parents who abide by this value may be helpful in the sexual acceptance process of their children in an effort to maintain family unity. However, internal family norms in Latinx families may promote negativity towards the LGBT plus community. And my experience is that usually familismo contributes to people retaining their kids in their house. And with their LGBT plus, they will not reject them as them to live outside their homes. But then again, once they're in their homes, it's like a sort of a torture around religion, around expecting them to change behaviors and expected to change or to negate their identities. So it's a very tricky value around the LGBT plus community because it could go definitely either way, but it tends to go in the way that is negative. Spirituality and religion is a connection with a higher being, spirits, saints, or others, reflects the idea that our future is predetermined. Religiosity, I'm sorry, but that has been associated with internalized homonegativity in bisexual Latino men. And there's a lot of research around how more religious beliefs lead to or correlate to more negative attitudes. 35% of LGBT plus Latinx are bound in religious communities, and religious practice and beliefs may reinforce patriarchal gender roles as well as conservative attitudes towards sexuality among Latinx. So when we see spirituality and religion in a family, we can expect negative attitudes towards this community. And we have to try to work with families so that they can work with the dissonation, that disconnect between having a belief but actually wanting to accept my son or my daughter. So that is important, and for us therapists and clinicians, this will be something important to deal with in therapy. Fatalism, which is associated with the religion as well, may be a risk factor among Latinx who believe that health and mental health conditions are inevitable and unchangeable as it's God's will. It says, literature says that it could have a positive impact among Latinx parents or Latinx LGBT plus who believe sexual identity is God's will. But some other people do not believe that it's God's will. It's actually, they believe it's against religion, which is sometimes unproductive for the LGBT plus person. Religion and spirituality may create conflicts between Latinx parents and their children and are also a source of support for parents who are struggling to make sense of the gender identity or sexual minority identity of their children. So it's going to depend if the person believes that what they experience is part of God's will, it will go better than if they believe it's not part of God's will. So that's important to know. Marianismo, it's another value that refers to traditional gender roles, social expectation of female gender to assume child rearing and self-sacrifice, emphasizes respect to patriarchal values, child rearing, being passive and submissive, as well as taking care of others. And this is almost, towards women and female persons. This research found that among sexual minority Latinas, Marianismo was a stressor in the coming out process. It caused tension between gender expectation from family members versus identity. They defined Marianismo as an expectation of self-sacrifice, maternity, and submission. And this study commented that frequently these expectations are taught to Latinas as a way of being a good woman. And sometimes their gender expressions is different, and when it's going to be different, they're going to probably experience more rejection, more discrimination, because they don't fit into the good woman definition or expectation. So that is going to be something that's going to work against Latinx women or female persons, because there is a big expectation around women, how they should carry on with their lives. Machismo is, on the contrary, is based on masculinity, associates male gender with protection, strength, and responsibility. Machismo emphasizes honor, courage, dominance, as well as a non-expression of emotions. So you can see other traditional gender values that are expected from male figures, and that is going to be sometimes problematic for individuals in the LGBT plus community. This research found that machismo contributes to a disconnect of emotions towards Latinx communities among immigrant gay men. So we can see in literature that machismo plays a big role on how do people work or express their masculinity, and the effects that that has on men and masculine persons in the LGBT plus community. So we're going to talk about different coping mechanisms that we and the impact they have on the culture. We're going to talk about family ambivalence, traditional gender role expectations, marginalization, objectification and sexualization, and intersectionality, invisibility, and distorted representation in media. So when we talk about family ambivalence, and I'm sorry, I'm kind of speedy, and when I'm talking, I want to get to the last part, which is the part that talks more about how to deal with all of this in the clinical setting. So I want to get to that mostly, and I want to get to questions and answer part, so that we can discuss a little bit more the concept that we're talking about here. So family ambivalence, this research showed that all participants reported being rejected by at least one family member, intertwined with acceptance and positive reactions causing stress experiences. One participant reported that while her mom has been more open towards her sexual orientation, which is bisexual, she hasn't been open to discuss it while she was dating a man. So there's a erased sexual orientation based on the partner that the person has at the moment. That happens a lot with bisexuality, and it's something that goes against the mental health of the person because it invalidates their sexual orientation and identity. Participants reported strong commitment, loyalty, and respect towards their family, which suggests that familismo plays an important role in the way they understood ambivalence. And sometimes, because of familismo, they expect that from their family, and they expect that is a normal way of normal dynamic of their family, that ambivalence, and they take it, and that can be very difficult for their psyche and their mental health. Traditional gender role expectations, participants express ideas regarding gender roles, with males expected to provide and be dominant, while females comply with child rearing, virginity, and dedication to the family. This suggests that machismo and marianismo play an important role in developing the family context as well as the community context, in some cases causing stress to the populations. Participants reported instances where they experienced gender role expectations having to do with marriage and having children. So our Latinx communities usually have much more rigid definitions of what a man and a woman should be. And then that definitely goes against the LGBT plus community, which is usually diverse in gender expressions. So that is going to be a shock to most families. And that is going to be point blank where the discrimination is going to come at. So usually persons discriminate towards gender in their early childhoods before even knowing their sexual orientation. They discriminate against what people that fall out of the expectations of what is to be masculine or what is to be feminine, and depending on what they expect from them. So that is very important to consider. Marginalization, 33% of participants reported feeling marginalized by different privilege and oppression systems working together to propel exclusion. One 25-year-old immigrant Latina lesbian participant explained that white lesbians tend to see Mexican lesbians as domestic workers. She spoke of classism, racism, and sexism, and how that overcrossed to shape others' opinions of Latinx lesbians. The experience of social inclusion is conditioned to how English is spoken, highlighting the social capital of whiteness among the LGBT plus community. LGBT plus communities assign privilege to non-Latino white homosexual men, suggesting that women with diverse ethnicities and others with sexual and gender diversity are excluded from full participation on the community. And this is super important. Latinx communities, which are LGBT plus too, they receive a lot of rejection and discrimination from the outside community, from cisgender and heterosexual communities. But they also receive discrimination within the LGBT plus community. Latinx people are marginalized from the white LGBT plus, the cisgender LGBT plus. So it's definitely going to be a second times or a different type of discrimination that they are going to receive, and it's going to be double the how prone they're going to be to minority stress. So because they might feel they're not even safe in the LGBT plus community. Gray and colleagues found that racial discrimination in the LGBT plus community and traditional Latinx roles contributed to feelings of disconnect with the culture among participants. So that is precisely what I'm talking about. It is important for us to understand the dynamics of the person that we're seeing, and when we're actually suggesting ways that they can be closer to the LGBT plus community in a way to be more in secure spaces, and they can relax and rest from the oppression outside. We have to be very careful if we do that for the Latinx communities and their expectation of what they might find when trying to enter the LGBT plus community. Sexual objectification. Moradi and Huang's sexual objectification has been described in the context of life experiences and gender socialization of women. Of participants, 28% reported feeling like sexual objects in the intersection of race, gender, and sexual identity. 3 women expressed feeling sexualized looks from others listening to sexual jokes, and men saying they were too pretty to be lesbians, as well as intrusive, and inappropriate comments and questions about their romantic and sexual preferences. One man identified being expected to behave in a certain way as a result of machismo. So people from outside are going to sometimes objectify the bodies and the lives of the people of the LGBT plus community. So it's very important, and males also receive some of it. It becomes a question of when people say, "Oh, you're such a waste, that you're bisexual or that you are gay," and that is going to be a part of the objectification of you're a waste just because you won't be attracted to me, right? Being from a heterosexual perspective. So that is going to be something that definitely weighs in the mental health of the community. Intersectional invisibility and distorted representation in the media captures the exclusion and distorted representation of Latinx sexual minorities in the US and Latin America. And we as clinicians know that the models that we see, social models that we see, are very important for youngsters and even early adults. So not having these models in the Latinx LGBT plus community is going to be troublesome. One participant, 21-year-old bisexual Latina, mentioned that US media hires non-Latino white cisgender actors to play Latinx sexual minorities roles, which may impact the way the audience perceives sexual minorities from diverse ethnicities. So when we don't see ourselves represented in media, that becomes a difficulty for me, because sometimes we cannot project ourselves to the future and to see ourselves as successful and as included in society if we don't have that modeling going on. So religion in the LGBT plus Latinx, I want to single this out, promotes heterosexual marriage, family preservation, and condemns non-heterosexuality. Religion is one of the main factors that research has shown that is troublesome for the LGBT plus community. Severson and colleagues identified how religious institutions identify non-heterosexual behaviors as problematic and stigmatized by using terms such as sin and sinful. Christians have limited acceptable sexuality to celibacy and heterosexual marriages with offsprings and has condemned homosexuality as morally incorrect. The main findings are that positive correlation between religiosity and masculine ideologies, internalized homonegativity, decreased comfort with receptive sex, low reliability of condoms, higher levels of loneliness and discrimination. So religion does play an important role in the attitudes that we have towards ourselves and towards the LGBT plus community if we're not part of it. So when we see what factors are protective, we see parental acceptance, we see lower sexual risk behaviors and lower substance use. And when we see the risk factors, we see parents or caretakers associated with increased rejection from them are associated with increased depression symptoms and psychological distress. So another main factor that is going to be super important is going to be parents' acceptance or rejection. That could go either way. And SAMHSA actually found in a research that they did that Latinx populations show lowest rates of access to mental health services when compared to whites. Link argues that among these populations, mental health services are stigmatized. And I was talking with a colleague the other day about this, and we were talking about popular refranes, how we some things that we say that are passed through cultures. I'm having trouble to finding out the word in English. And we, in Latinx communities, and specifically in Puerto Rico, we say, los paños sucios los lavamos en casa. The dirty laundry, we wash it at home. And that's a way of saying and advising people not to share their intimacies with someone else. In this case, being a professional. So there's a whole culture around not accessing mental health services in the Latinx communities. So we need to understand how that is going to be even more difficult for Latinx LGBT plus communities to actually access our services. And when they are immigrants, it is very important to understand that stress and anxiety are due to racism. Expectations of being negatively stereotyped is something that goes on. There's a lot of hypervigilance to threats because of sexual identity, conflicts between cultural values and personal beliefs, not accepted in many ethnic communities, and are unmotivated to seek resources and support from family or others. Acculturative stress is a thing. It's a very important thing for immigrants adapting to a new culture. Disparities between documented and undocumented immigrants is something very important to see. Undocumented ones are struggle much more. This research found less access to services as well as health insurance among undocumented immigrants. And that's going to be very important because there's a lot of legality perception around searching for services. Most people think that undocumented immigrants think that accessing services such as mental health are going to be a route for deportation. So this is what I wanted to get at. So we're right on time, so I can relax a little bit now. We are going to move our discussion to talk about affirmative model for the LGBT plus Latinx. So it's very important to understand that the affirmative model is something that came in response to other negative therapies that were performed to the LGBT plus community. They have been important for research, and most people that work with the LGBT plus community, we actually think that an affirmative model is the way to go, and it has shown important success in the literature. So we're gonna have to talk before we talk about the affirmative therapy model. We're going to talk about conversion therapies, and I put therapies in quote because it's not actually a therapy. Because therapies are meant to do good, while conversion therapies actually do bad. It is based on the idea that homosexuality and transsexuality is a mental disease. The objective is to change the client's gender expression or identity or sexual orientation. Things that are not diagnosis and are not something that is necessarily bad for the human being. Most organizations don't support this. So we have very big organizations like the American Psychological Association, SAMHSA, and other international organizations that actually frown upon this type of so-called therapies. Sorry about the external noise. So we're gonna see that these therapies actually work against the mental health of the patient, and people actually have died after them committing suicide. So these are very nocive strategies to do. And they take out of some models of psychology, like behavioral models and cognitive behavioral models, and they apply those type of strategies to their objective of changing the sexual orientation and gender identity. So we're going to see that this is not meant, those strategies are not meant for this. We don't study this, we don't research this, so it definitely becomes a very negative outcome after this. They are usually provided by mental health professionals, religious counselors, or other professionals who replicate heterosexist and cis-sexist views and promote prejudice towards LGBT plus communities. And we've seen in evidence in literature that there's a huge movement based on research that depathologize diversity. That's a mouthful. So it is very important to understand that this type of so-called therapies go against what we have seen in literature. So it's definitely not evidence-based. There are a lot of consequences on health, and we're going to see them after this slide. And there's a statistic on consumption because people have LGBT phobias internalized, and they are looking for help. But as professionals and clinicians, we shouldn't ever get into this because this is unethical and promotes harm towards the community. So why would people seek for these therapies? Religion. They feel strong attractions that they cannot deal with because of their worldviews. Low acceptance among family and community. So they need to change to be accepted to their family. So they really want to actually make this work. And research has shown even the people that are more motivated to change cannot change. So this is one of the this is psychological impacts around so-called conversion therapies. It's depression, suicidal ideation or attempts, self-esteem or low self-esteem, sexual dysfunctions, distorted perception, internalized homophobia, intrusive imagery, and monitoring of mannerisms. The social impact is loneliness and social isolation, loss of social supports, fear of sexually abusing, because that's one of the myths that they actually tell in therapy, and developmental delays. In spiritual impact, loss of faith, sense of betrayal from religious leaders, anger, shame, and punishment from God belief, and excommunication. So we're going to see a lot of consequences out of the conversion therapies. So the thing that actually works for the LGBT plus community is the affirmative approach. It's validated by most experts, societies, and organizations. It's not an independent theoretical approach, so we need to add theoretical approaches to this approach or this model. It's a special set of knowledge that breaks away from pathology. So when we use the affirmative model, basically we're using some of the things that we've learned today and in LGBT research, and we apply it to our therapy. And the belief, for example, that LGBT phobias are variables that increase the risk of developing symptoms. Once we know that, we need to work on how society views the individual and how we can make our individual or patient deal with those oppressions around him or her or they. So to be an affirmative professional, you should believe that living in a shame-based culture creates mental health disorders. And we want to move the client from shame to pride. Professionals accept, supports, and understand clients. Professionals should respect the values, beliefs, and needs of clients and self-determination, obviously. The approaches that go well with the affirmative model are person-centered approaches, multicultural approaches, and evidence-based practices. We need to work on active management, cognitive emotional strategies to cope with stigma and conflicts. That's what I was talking about earlier. Develop alternative cognitive frameworks, resolving cognitive dissonance, facilitating emotion and expression, and resolution of losses. And when we talk about losses, we usually talk about losses because when people of the LGBT plus community come out, they experience a lot of losses that people that reject them. So that is very important to address when we while we are at therapy. Exploration and development of identity offer the space and the option to explore an ample gamma of opportunities and reduction of conflicts without prioritizing one outcome in particular. So it's very important to not frown upon what is exploration of sexual identity and gender identity. And that is something that the person have the right to do, and it's not problematic to do. And we should leave the person for to be okay with self-determination. So our intervention goals are to be coherent and authentic identity definition by the client, to actually have a better definition about themselves, and emotional adjust them, how to work with shame, self-esteem issues, and values and norms of their culture. So I want to talk about some coping strategies that the literature sees in the Latinx LGBT plus communities, which are the development of critical conscience, strategic management of sexual and racial ethnic identity, seeking and creating a social support network for LGBT plus and community of color, and protective distancing. So these coping strategies are going to be important because they're not always going to be positive. They can be maladaptive. So we need to figure out how to best help them to achieve, to cope with their external oppressions. So strategic management of sexual and racial ethnic identity. Research has shown that different ways in which Latinx with sexual diversity manage their sexual and racial ethnic identity strategically to pass as white and or heterosexuals in different social contexts. Passing is a concept that actually makes it easier to pass through society. Sorry for the redundancy, but it's not being detected as Latinx or LGBT plus. So we can see upfront the difficulty in that. It's sort of wanting to lie or to appear as someone you're not, and that definitely has an impact on self-esteem and self-concept. 94% of participants reported thinking about the future, being conscious about one's environment and noticing how others interact with them. Also, when deemed necessary, strategically switching between Spanish and English, speaking English correctly, modifying wardrobe, and using makeup strategically. So that's one of the things that people of the Latinx LGBT plus community do to pass and not to be confronted or not to be a target of discrimination and prejudice and stigma. Seeking and creating a social support network for LGBT plus and community of color, seeking social support from others who identify similarly in terms of sexual and racial ethnic identity. This coping strategy was reported by the majority of participants. Support aspects include sense of belonging and identification. This is a very good coping mechanism, but we need to be very careful when we suggest this for our patients, just because of what we talked about earlier about the double discrimination within the LGBT plus community. Protective distancing, this is used as psychological protection and emotional and cognitive distance from current and future minority stress. 83% of participants reported minimizing or ignoring minority stress and its effects to guarantee safety, avoiding public confrontations, and maintaining more positive relationships. This is something to be very careful about, specifically because some distancing can be protective, but some distancing can become isolation. So it's something important to see. Development of critical conscience describes how privilege and oppression conscience is developed through daily expressions and work on combating oppressive systems. 94% of participants identify that they are very aware of privilege and oppression structural systems and how they connect to their intersectional identities. So it's very important for people to have a critical conscience about this. But having a critical conscience about it makes you more prone to see discrimination in a lot of places that there is. So sometimes ignorance can be a bliss in this sense, in a way that you don't actually acknowledge what's going on completely, or not, at least not all of the time. So it's a good, it's something important to actually unbox the critical conscience and how to deal with when to react, when to be an activist or militant, it is important to actually have a balance around that. It is not mentally positive to always be against everything and against oppression in all sorts of systems and all sorts of moments. People need to rest and have a balance around that. People need to live too. So moving away from home when not accepted is another coping strategy. Live or socialize with Latinx LGBT+, go through stigma, discrimination, and prejudice. Seek LGBT+ services, learn about community relevant issues, are other ways of coping with strategies. In a study in 2018, including young adults with sexual diversity, 51% of the sample was Latinx. Results indicated that the cognitive coping strategies, not thinking about minority stress and seeking alternatives and support, like finding new friends, were associated with poor emotional adjustment. Whereas strategies to directly address minority stress, for example, seeking LGBT+ services, were associated with better psychological adjustments. So avoidance, as you might see, is not something that becomes good for the mental health of the Latinx LGBT+ communities, but dealing with it is the most appropriate, and acquiring skills to deal with it is the most appropriate and healthy way of going about this. So this is other things that interfere with family acceptance in literature: machismo, intersectionality, respect, and religion. And these are variables that facilitate family acceptance. Those are variables that interfere with family acceptance, and variables that facilitate family acceptance are exposure to LGBT+ communities. And this has been shown in a lot of the research that if you are more exposed to the LGBT+ community, you understand more and you have better attitudes towards them. Available resources, if you read, if you instruct yourself or educate yourself, it's going to work for you into having more positive attitudes. Familismo is one of the things about respect that actually helps, but then again, it can be a source of two edges. We need to be careful with this, but in this research, it was shown that it was positive. And historical cultural explanations to understand where we come from and how sometimes it's difficult for our cultures to see things the way we need to see it for a better mental health. So as a summary, and this is something that I want to stay a couple of minutes discussing, and then leave like 15 minutes or so for questions and any type of communications that you want to throw at me. I would love to hear your points of views and questions that you have on doubts that might arise through the presentation. So first of all, there's a lot of diversity within the LGBT+ community. We should focus on gender diversity, sex, and sexual orientation. So as we said before, there's a problematic issue around the acronym. We can keep on adding, subtracting letters, and it's very important for us to understand that it's not about the acronym. It's not about the letters that we choose. It's about diversity in sex, gender, and sexual orientation. That is the most inclusive way of seeing it. Of course, for people to understand and to people to see what we're talking about and to understand in language that we're talking about something historically, we should use LGBT plus, because LGBT is what people recognize, but plus is the way that we include other categories that we talked about earlier and so much more, because we didn't get into the fact that bisexuality is an umbrella category, and there's a lot of ways of experiencing bisexuality, like homoflexibility, heteroflexibility, pansexuality, and other types of bisexualities. And the transgender community is also an umbrella category, which has a lot of other categories that actually express or define more how people express gender and identify as gender. And we have their androgyny, we have their drags, drag kings, drag queens. We have transsexuals or trans people. We have a lot of other ways of being transgender. So it's something important to understand that when we include other letters, we need to be very inclusive. So being completely inclusive means probably have the whole alphabet in line, because there's a lot of diversity when we're speaking about the LGBT plus community. So that's something important to consider, and that's something important to understand. When we talk about gender and sexual minorities, that's a way, but the minority part is problematic. It speaks to numbers, and people think that we are a small community, but specifically in the population, it's a big number. For example, 1.4 million persons identify as transgender, and that is something that is a big number. So we definitely need to look at it in a different way. The minority stress model explains that intersectionalities are important in predicting exposure to violence and oppression. Latinx LGBT plus are at higher risk for developing psychological symptoms when compared to non-Latino white LGBT plus. And there we're not even talking about race. Darker skinned Latinx people are definitely going to experience a lot more hate, a lot more violence. So we need to keep that in mind. And when we're talking about Latinx that are from diverse religions or diverse socioeconomic status, that increases the chance. This increases the chances of being exposed to violence and oppression that can definitely lead to psychological symptoms. So when we're dealing with the LGBT plus community, we need to address those intersectionalities and actually ask about experiences on being part of all of those communities at the same time, and how does that feel? We sometimes want to definitely go and ask them about their how they were brought up, how their experiences going to school, their family dynamics, their experience at work, and we should do all of those questions around the fact that they have intersectionalities and how that affected their development through life and their impact on trauma, and definitely choosing trauma informed models, because even as we every time it's more abundant, the literature that tells us that trauma is something very important to address in the LGBT plus community, because experiencing and living in a cisgender and heterosexual in a cis-sexist and heterosexist world makes it traumatic to be LGBT plus. So that's something that we definitely need to understand and look for and address and help people cope with those experiences. Latino culture's values may facilitate or interfere in the acceptance of LGBT plus persons. There's much research to be done in this sense. I think we talked about the main researchers that actually are working on this, but we need to ask clinicians, maybe not necessarily researchers, but in clinic settings, we need to see how familismo, how machismo, how marianismo interact with the person that we have in front of us. Sometimes we can see subtle ways it interferes or facilitates their development, but also we can see very clearly how this can be difficult for them. It's difficult for sometimes for people that are Latinx in the LGBT plus community that to erase the respect that they have for their families. And sometimes I have had cases that or have been working with patients that decide not to come out or not to be in relationships just because they're still living with their families, and they want to respect their worldviews, their religion, or their views towards the LGBT community, and it becomes something that interferes in their relationships and the family dynamics, and sometimes makes the person be isolated from their families but living in their homes. So it's something to address and something to look for when we're definitely trying to work with the LGBT plus community and helping them to become the best version of themselves. Cultural values should be taken into consideration when working with affirmative models in order to increase effectiveness. So this is something that we really need to work on. Affirmative models have definitely given huge successes when we're working with the LGBT plus community. It's a way of not judging and not imposing our worldviews on them. I would say on us. So it's something important to understand and to really unbox when we're talking about LGBT folks in therapy, and especially when they're Latinx. So we need to do a merger between the cultural values that come from the being Latinx with how we work under the affirmative approach. So that's super important. And I'm gonna leave you with this quote, which is from Mahatma Gandhi, that says, "Our ability to reach unity in diversity will be the beauty and the test of our civilization." And months like the ones we're in actually celebrate diversity. And it's important that we feel that Pride or Pride Month or Pride celebrations or the Pride March is for every single one of us. It's not only for the LGBT plus community. Research has shown that when we have inclusive curriculums or gender and sexual associations in school, the climate of the school changes for the better, not just for the LGBT plus community, but for other communities as well, and for the entire majority of persons there. That those research that are similar in the workforce, for example, when we have workplaces that actually have diversity clubs or diversity associations of employees, and they practice protocols and procedures that are affirmative, it definitely changes and makes the work climate better. So we have this already in literature that is something that gives us maybe the tools to go to our different places of work and of school and all of that, and to make changes happen. So being prideful and participating in LGBT plus events, it doesn't only work to better the lives of the LGBT plus community, but to make the world more acceptance and inclusive. So thank you for hearing me talk. This is the end of the structured presentation, but I would definitely want to, I'm looking for the unstructured part of the webinar where I get to hear from you guys and hear your doubts and anything that you want to say. So I think the moderator is going to help me with the questions and comments, and while we're doing that, you can see the ways of contacting me if someone doesn't feel comfortable enough to make a question in a larger setting with more people and want to do it privately. You can do it this way. I'll be gladly to help or to share my 2 cents. So moderator, you let me know.
Thank you very much, Dr. Vasquez. We have 2 questions for today. Thank you for your presentation. It's amazing. So the first question is, how do you explain, or when you're working with older adults, how do you explain to them when they present difficulties to also explain to their friends that they have a daughter or son that is part of the LGBT plus community?
Let me see if I understood correctly. It's how do you work with older adults that are not part of the LGBT plus communities, but actually have daughters and sons that are part of the LGBT plus community, how to tell them to friends and family? Is that the question?
Yes, that's the question.
Well, first of all, I believe that we need to work on the myths and information that this person has, that the parent has or custodian has towards the LGBT plus community. There's a lot of myths that people believe, and that works against understanding why their sons or daughters are part of the LGBT plus community. There's a lot of shame, specifically in Latinx communities, and there's a lot of guilt when thinking that they were part of that development, of that diversity, because they weren't around that much, or they were they smothered them too much. Those are myths that actually research has shown that there's a big biological component to the sexual and gender diversities. So there shouldn't be any guilt from the person. And we need to work on that, on understanding other myths that the person might have, that if the LGBT means that they're going to be sick of, or they're going to have HIV or other sexually transmitted diseases, which is also a myth. And there's promiscuity myths. Sorry about my English. That is also problematic to understand the lives of our sons or daughters. So we need to really work with the parent to make them understand and debunk some myths and unbox where they come from, because research has done a lot for us. And one of the things that research has done is to actually give us the tools and information to give them and to educate them so that they can feel okay and they can feel proud of their sons and daughters. So thank you for that question. That is a very good one.
Thank you. That's amazing. And do you have resources for clinicians? You can share resources for clinicians that are working with Latinx from the LGBTQ community?
Definitely. And thank you for the question. Well, what I want to do two things. I want to say that we're working with the MHCDC to give LGBT plus certification, which will have a lot more information and resources for clinicians. So ask them about the initiative that we're going to have. Also, I want to do a shout out to a couple of places that actually have great resources for our community. One is PFLAG, which has resources in both English and Spanish, and that helps a lot. We have GLISTEN. GLISTEN is an organization that works in education, and specifically for school climates, and that has a lot of information for how to do how to work with more inclusive curriculums, and how to well, basically make better the school climate for LGBT plus communities. You can find out more information about True Self Foundation, which is my foundation in Puerto Rico. What else can I say? Other resources, you can definitely contact me, and I'll be happy to share. I have to say, there's a big limitation on resources in Spanish, so it is troublesome sometimes, but I have a couple, so please let me know.
Thank
Dr.
you.
Vázquez, can you repeat the first one you mentioned? I already added Ethan and Choose Foundation links on the chat so that I can look it up.
Yes, the other is pflag.org. P as in Peter, F as in Fernando, LAG as in gay. PFLAG.
Awesome, thank you.
That organization it is based on families, and it's from families to families. So it has great resources for families. It used to be called Parents and Friends of Lesbians and Gays. That became problematic because it was exclusive, not inclusive. So they changed just the acronym. But they are very good at what they do, and they have a lot of pamphlets for family members in Spanish. The story of how PFLAG came to be is depicted on a movie which is called, of course, I'm going to forget right now. I'll get it. Prayers for Bobby. Prayers for Bobby is a great movie to give to parents to understand the struggles that the LGBT plus community go through, specifically gay communities go through in the coming out process, and how that can turn out in a very bad and very bad way for their health. I'm not gonna spoil the story, but it's a good movie to see. There are subtitles in Spanish, I think in YouTube, so that helps for Spanish-speaking Latinx.
Those are great resources, and thank you, Cindy, for putting on the chat so everyone can have them. Also, Dr. Vasquez, we can put the next slide. And also, I want to remember the participants that if you have a question, feel free to write it down on the question box. Also, we have our link for the survey. We want to continue to provide training like this one. So for us, it's really important your feedback. So here's the link. Also, you receive an email with a certification of participation and with the link to complete our survey. We still do not have more questions. I don't know if there is something else that maybe you want to share with us before finishing.
Well, I want to say thanks once again for being here. I know this is not a friendly topic or subject for a lot of people, and I wish that you listened with an open heart and with personal feelings and beliefs aside, because the LGBT plus community needs a lot of help from us clinicians. There are very few affirmative therapists out there. So if you're very interested to keep on understanding the LGBT community and working for a more effective and sensible way of addressing their issues, please contact the MHTTC. Tell us, say in the Survey Monkey other topics and subjects that you want to hear from us. I think that's going to help a lot, and I think when we add ourselves to this movement, we contribute to society as a whole, because I really believe that this is one of the most important, the third most important human diversity and battle that we have. So just I want to say thank you, and thank you for the MHTTC for the invitation.
Thank you. We're so happy to have you here today and to bring this such informative presentation. And I think this is an amazing tool for our clinicians that work specifically with Latinx from the LGBT plus community. Thank you very much for your time and your participation. And thank you for all our participants. Have a nice day.